Welcome back, everyone, for the final session of the day. Chelsea Rivera, Rhonda Banchero, and Zakaria Herzlich will be speaking about incorporating DEI in behavioral health agencies. Chelsea Rivera is a data analyst for equity and inclusion at Downtown Emergency Services Center in Seattle. She has a BA in sociology from the University of Hawaii at Manoa and an MA in applied sociology from the University of Alabama at Birmingham. Her love of research and social justice drives her work to let the data tell the story. Rhonda Banchero is the Director for Organizational Equity and Inclusion at Downtown Emergency Services Center in Seattle. A DEI activist, corporate trainer, and former professional basketball player, she's deeply passionate about diversity, equity, and inclusion. Her expertise lies in authentic, honest community building and fostering workplace inclusion through practical strategies and partnerships that align with DEI goals. She believes in the transformative power of collaboration and fostering community within the workplace. Zakaria Herzlich is the Senior Manager for Organizational Equity and Inclusion at the Downtown Emergency Services Center in Seattle. With an academic background in psychology and gender theory, Zakaria enjoys theorizing social norms and expectations based on gender roles and the psychology behind what is expected and what is produced by humans. With a myriad of marginalized identities, she is passionate about using her lived experience to help dismantle these expectations, liberating people from marginalized communities from the inequities and exclusions that often result from power privilege struggles. Thank you so much for joining me on stage, everyone. And now I will turn it over to you.
Hi, everyone. I'm Rhonda Banchero. Thanks for joining us today. We're so excited. I believe this is our first time as an organization presenting here. So we're super excited to be able to present for you guys today about incorporating DEI in behavioral health agencies. Next slide, thanks. Oh, okay, well, here are all our faces. Those are all our great headshots. Sorry, I'm a little less, no makeup today, but we'll move on to the next slide. I think our introduction was sufficient. And so just a little bit about how the Office of Equity, Organizational Equity and Inclusion came about at DESC. This is a new position that was erected in the agency in 2021. So I am the first director for DESC in this role, as well as Zakaria being the first senior manager for this role. And this role really was in response to our equity and social justice team, as well as our anti-oppression group, really challenging the organization to, conduct an equity assessment because there were just some gaps there, some clear gaps in and around their efforts and the overall efforts that the employees and the frontline staff felt the agency were embarking on. So in 2021, we had an outside group come and participate and or conduct rather an equity assessment for the organization. And just for reference, our organization is about 1,100 strong and growing. And so in 2021, they conducted this equity assessment, and the findings were probably not shocking to people in this arena, but something that I think was a great support and reinforcement eye-opener for the need for equity and inclusion to be a director level, leadership level position within the agency to be able to really impact and lead change. So we're going to go over some of the just kind of the themes and some of the things that came out of that report. We won't bore you with all of the report. It was probably 47 pages long. So we're pulling out the most talked about and mentioned themes that the equity assessment was able to delineate. So one of the things is we, as an organization, wanted to have more intentional hiring and opportunity for promotion for marginalized groups and people of color. Again, these bullet points, I won't go over all of them, but some of the things that we've been able to do is really ask an intentional, detailed question about equity and inclusion to everybody who applies to DESC. That is also on our application via the web, and it's something that is an introductory question during our phone screens when folks reach the point if they're going to be interviewed at our phone screen. So it's really at the very beginning of the process for hiring. We also use an Equity Lens checklist for major decisions that impact DESC, and that's for RFPs. It is for decisions that are made within the agency, whether or not we are going to take on a program, start or stop that program, as well as potentially where we're going to be building some of our housing units. We have an internal publication of all of our supervisory level positions. And so we leave those open for at least a week. In some cases, we leave them open for 2 weeks to give our current staff and internal employees an opportunity to see and apply for the position first. Also, we conduct exit interviews to help explain attrition and to make ongoing adjustments for future needs of a particular position or program. Also, what was created, and one of the first things that I did when I started in 2021 was to create an anonymous employee reporting form for all DESC employees. And this was really for employees to be able to feel safe, that they could report things like microaggressions, discriminations, things that were really impacting their ability to do their work or to have an enjoyable work experience here at DESC that didn't quite rise to the level of HR involvement, but things where microaggressions and maybe even up to macroaggressions can be a little bit harder to put your finger on. So really, that employee reporting form is something that employees are able to fill out. And there are a myriad of choices, which we'll see in the following slides, to let us know and inform the office as to what the desired outcome is as the employees are reporting. So this is a screenshot of what the actual employee incident form looks like. And you can see it's a little bit small, but you'll see in the number one that you can check the category that you're reporting about. So for those of you who have trouble reading, I'm wearing glasses too, so I'm going to be squinting here. Are you reporting about microaggressions or discriminatory incidents or comments being made, homophobic and or transphobic incidents or comments, hate speech, or something else? It also asks, again, it's anonymous if folks do not wish to be identified, but you have the option of putting your name in. And just as an aside, we find that most people are fine with being identified because it's only coming to the office. And so if we have to go and have a conversation, we'll ask, are they okay with being identified? If not, then we keep their name private if we need to address the situation. We ask which department or work group they're in. Did the incident happen within the department? Were there any clients involved in the incident? Another probably most important question is, what is your hope that comes from filling out the form? And so we give people, the run of the gamut. Either I just wanted to get it off my chest, kind of an FYI for your information, all the way to they would like help or like support on reporting it to HR and or help in solving it amongst the employees themselves. Also, because we do, our employees are members of SEIU 1199 Northwest, we do give them the option of having a union representative present if the conversation is going to go outside of the employee reporting form. And so these are actual reports. So part of it didn't show on the previous couple slides is we ask what happened. And so we give the employees an opportunity, if they wish to fill out this form, to tell us their version and or how they perceived the event unfolding. And so, I won't go into detail. You can read it, hopefully, if you can. We struck out the names. But, they report a little bit of everything in terms of between microaggressions, discrimination, homophobia, and those things. Just so you all are aware, when it comes to discrimination, homophobic or transphobic events that are being reported, we do partner with HR immediately to alert them of the event, and then we coordinate with HR very closely as to how to handle the situation. Oh, and so this is a little bit more close-up version. Oh, okay, we're gonna go right. What do we do? Okay. So this is just a close-up of the report. And you can see here just one sentence is, I didn't have and hadn't been addressing the daily misgendering and microaggressions as I'm busy, and I don't feel precious about mine. I just try to assume good intent and go about my job in life. But it's deeply concerning and it's something that they felt the need to report. So, we are very responsive. We usually respond within 24 hours, certainly within 48 hours, and make sure that people know that their report was heard or taken, and that we're going to be taking a look at it. So this is just, a snapshot of some of the responses that have been submitted. So you can see kind of where they fall in terms of percentages of the types of reports we get. 33% are microaggressions, discriminatory incidents, 9% homophobic and or transphobic incidents, and 6% hate speech. And this is what they have marked in terms of the choices that are given. We do have had very small instances in terms of percentages where someone felt like someone making a remark about someone's weight was hate speech. So there is sometimes a little bit of education that goes on that might skew these percentages, but not too much. Again, this is just stats from some of the responses that have been submitted, where people have just tell you what they would like or desire as a result of the report. So 14% want to get it off their chest, no action. 31% would like for the equity director, and we probably need to change that. I was an office of one until about a year ago, so we probably need to adjust that language a bit. But would like the equity director to contact and talk with them about it, and then so on and so forth, all the way up to broach the subject with the person and or contact HR. And that's just another slide to show a different visual for the same percentages that we just talked about. Okay, Chelsea, is this you? This is you? Yep, great. Okay, so thanks everybody. We're looking forward to questions at the end of our presentation. And yep, introducing Chelsea Rivera, our really wonderful data equity analyst, which we're very lucky to have someone that is committed to collecting data on our equity and our equity efforts here.
Yes, well, hello everyone. Like Rhonda said, I am Chelsea Rivera. I am a data analyst and I focus on equity and inclusions. I work at DESC with our Office for Organizational Equity and Inclusion and also our Quality Information Management team. So it gives me a really position to be able to see how things are working, not only on the equity side of things, but also getting insight to how things are happening across the agency. So I'm going to go into demographic information. So at DESC, with clients of various levels of ability. We work with clients who have mental illness and often are unhoused. And so at DSC, working with our clientele, being able to look at how we are helping these vulnerable populations and what we are actually doing. And so first, the question is, how do you even collect demographic information on those that you are serving? And so one thing that is really important to me, but also to the agency and how we are trying to navigate these things, is using that demographic information to review our areas of service provision. So understanding the demographics of who we're serving and of who the community is in need of, who in the community is in need of these services, allows us to see if there are any trends or if there's any disparities in the way that we are managing and acknowledging people. So some examples of that, one of the big initiatives that has happened at our agency is called Living Conditions. So prior to COVID-19, our staff were able to go into clients' rooms and be able to help them with their conditions of their unit. And so during COVID-19, there was a lot of changes when it came to being able to engage with clients around the status of their unit and being able to help them to maintain a living condition. And so after COVID-19, the housing department was looking at how we can make sure that our clients are living to a standard that we think is great, and so the Living Conditions initiative, using these three colors, just red, yellow, and green, is a way to categorize the unit status. And so the green unit is just something that is consistently clean. Often these clients are more independent and they do not need as much assistance when it comes to making sure their unit is tidy and also ready for inspection. Our yellow units are somewhere in between. So sometimes it may need just a small cleanup, and the tenant often responds to being able or interventions from staff. And so moderate clutter. And then our red are any units. Typically, these units are clients who have hoarding. And so there may be physical damage to the unit. The client may not want to engage or may not be able to engage in cleaning of the unit and maintaining it in a certain way. And so using these three colors is a way that we look at how the units are being maintained. And then for my position, being able to look at those living conditions and look at the demographic information of those clients so we can see whether or not there's something going on. So for instance, demographic categories such as age, gender, race, veteran status, looking at that with the unit status to look at the proportion of units within those demographic categories. So for example, if we see that 70% of our green units are inhabited by female residents, what does this mean? So being able to use our service provision and also the demographic information can allow us to see if there are any trends or disparities that are, apparent, but then we can continue to track that over time to see if it's something that is persistent and that we need to address. So next, mortality rates of the unhoused. I include this slide because it's important to understand for our clientele what they are up against. And so understanding that those who experience homelessness have a 60% greater mortality risk than poverty alone. Also, those who are non-elderly and have experienced homelessness have a 3.5 times higher mortality risk in general. This graph shows the probability of death among those who are of various housing states. So those who are housed, those who are poor and housed, and then those who are unhoused. And so you can see that from the COVID-19 pandemic, there was a huge increase across all, but a major increase for those who were unhoused and the probability of them dying. And so with this information, understanding that our clients are more at risk of passing away, and because DESC provides not just housing, we also provide clinical services, it is important for us to be able to track. And prior to my role, the DESC had tracked client deaths, but we were not able to get those. Hello, I think I'm frozen. Can you all see me?
You're frozen, Chelsea. They went back to your thumbnail, but we can still hear you.
You can hear me. Okay, great.
Yeah.
So DESC tracks clients' deaths through electronic records, and being able to understand not just what we assume the client passed away from, but being able to open that communication with the medical examiner's office to verify those causes of death, to see what's going on with our clientele was important for us to be able to actually see what's going on. And so in the office, we were able to update the policy and the recording structure for client deaths and working with that medical examiner's office to verify what is going on. So utilizing this death data, we can monitor if there are any disparities based on demographics and the cause of. So similarly with the living conditions, we are doing similar things with cause of death. So looking at age, gender, race, and pairing that with an area such as cause of death that we get from the medical examiner's office can allow us to see what is affecting our clients the most, and if there are any disparities in what's happening over time. So Rhonda did mention the office has been in office for 3 years. I've been in this role for a year and a half, and Zakaria has been in her role for a year. And so we have been working still in the earlier stages of, implementing these things and looking at how we can track this over time. But the sweet spot is really in being able to get data and have that over time, because when it comes to looking at disparities and when it comes to looking at data and statistics, it's important to remember that a number from a point in time count means just that. It's just a point in time. And so being able to really say if there are disparities that either we're perpetuating as an agency, or if it's something that is going on externally that we cannot control, but we still want to acknowledge in advocacy efforts, it's really important to have that data and be able to track it over time. So so this is what, in my role, I have been able to spearhead and lead to see these areas that we can not only use our data, but use those demographics to see the story of what's going on with our clientele. And now I'm going to pass the mic to Zakaria.
Hello, everyone. Zakaria Herzlich, she, her pronouns. I'm the Senior Manager for Organizational Equity and Inclusion, and come beginning of October, I'll be celebrating my first birthday at DESC, so that's exciting. So one of the things that we have taken on as an initiative for the office are external applications and resources that help foster equity and inclusion and diversity within the agency. One of which being the Racial Healing Handbook, which is a workbook that has practical activities that help challenge privilege, confront systemic racism, and engage in collective healing. On the right there, you can see the lovely author, Annalise Singh. And so this book was a first of the OEI's agency-wide workbook initiative, where it was introduced to DESC in February of this year during Black History Month. And each month there are agency-wide chapter discussions, one chapter a month, where there's also recap emails sent throughout the agency at the end of each month to kind of collectively bring everyone together and move on to the next month's theme. And here's a more close-up of the book itself with the summary on the back. As you can see, it's very complementary to our DESC colors, which is always aesthetically pleasing. And if you can move to the next slide. Thank you. So one of the things that we strive for is accessibility within the agency. So within this project, we have made it accessible physically to have different physical copies throughout the agency passed out along different sites to different employees. We also have electronic resources, so the PDF of the actual workbook on our internal website, on our SharePoint, along with its resources, the worksheet pages, the ratio healing practice activities, and then we have links to audio book recommendations. I think the book is on Spotify, Audible, and a few others that I'm unfamiliar with fully. But we like to make sure that everyone at DESC can have access to and utilize all the resources of the handbook. The racial healing wheel is a depiction inside of the book itself. The author refers to racial healing as a journey that is not linear and that is often a cyclical journey. And so the depiction of the wheel is also a replicate or a representation of the table of contents and each chapter. So there are 10 chapters within the book, and we started in February. We're going to be ending in November so that we can collectively, reflect over the holidays. Each month's theme is the chapter, starting with knowing your racial identity, exploring internalized racism, relearning the history of racism, grieving and naming racism, raising race consciousness, catching yourself in the flow of racism, understanding racism in relationships, reclaiming your whole racial self, which is September's month. I know the months on the wheel are actually out of order, so I apologize for that. And then for October, we have Be a Racial Ally, and then our last month, November, Engage in Collective Racial Healing. And so here is a screenshot of just a few of the monthly recap emails that we send out at the end of each month. They include different chapter themes, subsections, and the racial healing practice activities. And so during the midway point of the book, so around August, we had an anonymous involuntary survey just to gauge the progress, issues, questions, and concerns that were related to this agency-wide implementation. And that was for chapters 1 through 6. So here are some screenshots, just some snapshots of the data that we collected. Out of the 102 respondents that took the survey, 42% were employed in housing, 34% in clinical, and 24% in admin. Unfortunately, there was a racial disparity where 46% of the respondents were identified as white, then 21% as Black or African American. And in terms of gender identity, it was a little less skewed, but it was still not an equal amount as we had hoped. 46% identified as women, 34% as men, and 15% as non-binary, gender non-conforming. And then age group, I would say it was pretty spread out. Between the ages of 18 and 29, there were 19% of responses, 30 and 39, 27%, 40 and 49, 32%, 50 and 59, 14%, and then 60 and above were 6% of responses. And so one of the things we noticed when the survey was being conducted and was still open were the initial amount of responses were leaning towards negative, and the most at the time, the majority of respondents identified as cis white males. However, once the survey concluded and we had that more of a balance coming up with a higher percentage of women identifying people who took the survey, the responses sort of took on a neutral approach. So for the most part, the overall feedback for the book was neutral. But again, this was only 102 respondents at an agency that has close to 1,000 or well over 1,000 coworkers. So 32% identified as neutral, having grouped discussions that were fruitful, diverse, equitable, and inclusive. 39% were satisfied with the progress. 25% were satisfied with the actual book that we had chosen as an office. And the good part that I really, and I know we all were excited to see, was that 64% of respondents were having at least one group discussion a month, which is mandatory, which was assigned. So that was great to see. Okay. And then on a scale of 1 to 5, the level of impact and use that the Racial Healing Handbook was to respondents' work was about a 2.44. Again, leaning towards the middle ground, neutral in terms of the bar graph to the right. And then the bottom two snapshots are just word clouds of different themes that were commonly found amongst the respondents. Okay. Another initiative that we had done around Black History Month in February of this year was a DE&I, diversity, equity, and inclusion calendar. This is an interactive calendar. I know it's pretty small to see. I have September on the screen there for you all. But the words for each day are interactive hyperlinks that will take you to external websites with different resources. So this is the first agency-wide DE&I calendar that OEI has rolled out, and we hope to continue them as long with adding a newsletter in addition to this. So this calendar is accessible as a PDF through our SharePoint, our internal website. There are immersive reader views for language translations and audio descriptions. And there are resources on the page to current and past months posting. Each calendar or each month has at least one theme that is related to DE&I with resources and explanations for each. And as you can see for September, we have a trifecta of different themes. We have Hispanic Heritage Month, which is currently happening now from September 15th to October 15th, National Recovery Month, and Suicide Prevention and Awareness Month. And yeah, just a little blurb here. The interactive calendar aimed to highlight monthly DE&I themes related to national days of observance. They can be accessed within the calendar, as I had mentioned, with those hyperlinks. And the drop-down menu shows to the right the current and past months that we've had at DESC. Some months have one theme, some months have two, some have three. So just a little snapshot for you to kind of get an idea. And here is the entire year's calendar themes. We tried to make them color-coded and very aesthetically pleasing, as well as related to that month's theme or themes. One thing I forgot to mention was, I don't know if you're able to see, but in certain corners of the calendar, there are words that are the DESC kind of teal color. Those are actually links to each individual chapter of the Racial Healing Handbook's monthly assignment. So if you want to check out, oh, what's on the agenda for this month? Oh, I have to read this chapter. It's all there in the calendar for you. Okay. And here's a snapshot, an example of one specific monthly theme. So for March, we had Women's History Month. On the left, you'll see the body of text is a blurb that's often written by OEI, Office for Organizational Equity and Inclusion. So the three of us will either come together or one of us will write the blurb. However, sometimes the blurb will be collaborative with other employees because there are monthly themes that not each of us in the office identifies with, and we want to go ahead and give those who do identify with these themes or these communities space to have their voices uplifted. To the right, you'll see that there are three different sections within this page that are similar on every single page. So you have informational links, you have related articles for individuals who identify with these themes or are in these communities that we're uplifting those voices externally, not just within our organization. And then at the bottom, you'll see that we have external video content that is related to that month's theme. And here's an example of a specific, for May, one of the themes of May was Asian American and Pacific Islander Heritage Month, so AAPI month. And no one in the office identifies as being a part of the AAPI community. So the white areas are blocked out, informational pieces from employees that identify them. Some employees will, when they collaborate with us, they choose to remain anonymous. Some choose to remain, open. But this is just an example of when we collaborate with other employees that work at DESC, how their voices can be uplifted and shared in relation to the specific month that we're highlighting. Okay. And then Chelsea and Rhonda, feel free to jump in. We also have these caucuses and equity groups here at DESC. So they're different, and each caucus meets at least once a month. Some meet multiple times a month. They hold different events. They will collaborate with each other. Different caucuses can collaborate, and different caucuses will often have community together. Some that are active right now are the African Immigrant Meeting Caucus, the BIPOC Caucus, Black, Indigenous, People of Color Caucus, the Trans and Gender Expansive Caucus, and the White Anti-Racist Planners Meeting. Sorry, my LASIK's not LASIKing right now. So yeah, we hope to have more caucuses. I know we are working on getting the Feminist Caucus back, and I think the Equity and Social Justice group is making a comeback as well. Did you want to add anything, either of you?
Oh, I was just going to say that these are true caucuses, so they're employee-led. We, as an office, provide the platform, and obviously, if someone feels like there is a caucus missing, we will, as soon as we get a statement of purpose, we will erect that caucus, or at least in name, and it really is an employee-driven effort that preceded myself and anyone in the office, but something that I think is really important to the fabric of our employee experience is to be able to have a place to share and check in and, just have some fellowship and community within the agency.
Yeah, and then just some future OEI endeavors for our office. We hope to have a survey at the end of the year for the Racial Healing Handbook, just to kind of close off the year and see reflection from the midway point and then the end point. But this is the tentative, hopefully, book that we're going to be using next year. It is by the same author, Annalise Singh, and it is highlighting queer and trans resilience. We'll also be working on an LGBTQIA plus glossary discussion that will deal with terminology and current events for next month, which is the theme for next month, October, is LGBTQIA plus History Month. And we hope to have guest speakers. Hopefully we'll be getting the author Annalise Singh to respond to one of our many emails and requests to please come and discuss such a great book and initiative that has been so fruitful for our organization. And I will open it up for Rhonda and Chelsea if you want to add anything for the future OEI endeavors.
I will add, as a data analyst, there are a lot of things that I mentioned within this presentation that we obviously have going on in the background and are interested in exploring further, especially when it comes to looking at not just demographics, but also the other areas that impact our clients, such as their various mental illnesses or their physical illness and how that can impact other things as well. And so obviously this is just a taste of some of the things that we are looking forward to do in the Office for Organizational Equity and Inclusion here at DESC. But we look at this as a starting point since our office is fairly new and especially new to the agency. So getting a chance to start some of these things and then hoping to improve on them as we continue to grow.
Yeah, thanks. And I was gonna say as well, we look at the office and our equity efforts as a multi-layered approach. We definitely, believe that it's important for an agency such as ours who deal with marginalized communities economically and obviously culturally as well, to really try and inform some of the experiences that our direct line service staff is having with our clients, but as well internally for us as leaders in the organization, we want to be, participating and leading efforts that are reflective of some of the life experiences and lived experiences out in the community that our employees have and certainly that our clients have. And so we really, as an office, look at this as a multi-layered approach and understanding that, people are going to take and identify with certain bits of information and or education that the office puts out, but needing to really be broad in the approach. And so, of course, there's not one size that fits all. I'm sure there are some folks from DESC here. We've had a lot of conversation, pushback, and kudos for introducing an agency-wide reading that the leadership team and our directors agree that it should be mandatory in terms of reading and mandatory participation, which just means you need to show up to the discussion. It doesn't mean that you have to participate. And, we're having ongoing conversations about those things. But we really believe that, what is good and what is best is not always going to be the most comfortable or the easiest. And so we're pushing forward ahead as an agency. We're pushing forward ahead as an Office of Equity and Inclusion. And gosh darn it, they might walk me out the building, but we're gonna leave it better than how we found it. So I appreciate all of your time, and we'll open it up for questions and discussion.
All right. So I just want to draw attention to the chat before we go to the questions. There's so many people just saying thank you so much for this, and thank you for your hard work. And they really appreciate the presentation. So I just wanted to make sure you guys saw that. And I can tell you now, we're not going to get through all of these questions. There's a lot, but we're going to try and get through as many as we can. So what are your thoughts on how the employee incident reporting around bias can be used to create cultural change within the organization?
That's a great question, and I'll try to be brief so we can get to as many questions as possible. That is an ongoing conversation. Again, we work really closely with HR to talk, even if the employee just wanted to get it off their chest. It doesn't mean that we don't bring it up in meetings where we're coordinating together so that we can make sure that we're addressing it maybe broadly. Maybe we erect a training. Maybe we ask for directors who are facilitating meetings to just bring up broadly a situation that, that is related to microaggressions or something that's been reported, just to try and address it that way.
If you don't have a designated DEI team, who would you recommend reviewing employee reporting form submissions?
Probably HR, and I would definitely push for there to be a varied kind of panel of people, if you will. If you don't have a designated DEI team, which we do, I would say someone in HR and maybe ask for a more rounded out smattering of people who could, maybe like an ombudsman board or something like that.
Mm-hmm.
Can you talk more about the development of your reporting form and how you decided how notifications are sent to whom?
So the link is both on our intra site. It's in the signature of my emails. It's something that when an employee may go to either a fellow coworker or they may go to a supervisor, the supervisors do instruct them to report it to through the employee reporting form. So we don't necessarily send it out. We just try to make it available and, definitely vocalize and make sure that communication is there, that it's available for people to use as a resource.
Okay. What types of training programs or educational initiatives have you found most effective in promoting DEI within behavioral health settings?
Great question. I would say, you know, a lot of some of the things that we find that are being reported, they don't always boil down to, but it really is about communication and effective communication. So where someone might think it's okay to say something not super egregious, so I'm not talking about a slur or anything like that, but kind of those more nuanced things, how to have difficult conversations, giving and receiving feedback, because we do believe that it's important for the employee to, or the person experiencing the microaggression or the discrimination, to be able to give feedback in the moment. So how to give and then the person who's getting the feedback to receive it. And so we find that some of those trainings can really help to open up the lines of communication and for people to know how to receive that information, but also know potentially how to give it. We do a lot of talking about calling people in. So are you wanting to have a discussion with this person about something that happened? And we have some scripts around that. There's a really great script in the book that we're reading in chapter 5. And then also, or do you want to call them out? So, those are two different things, because calling somebody out, you're wanting them to stop what they're doing, stop talking, and you're not interested in a conversation. Calling someone in, which is more usual when we're talking about professional setting, is more about, hey, I actually want to have a conversation about this. I want to hear more context as to why you said that or what you meant by that. And so really trying to have those discussions and provide trainings that support that.
Thank you for explaining the difference of calling out versus calling in as well. This is not a question, but I just want to make sure that I get it to you. Somebody said, please consider updating to DEIA to more explicitly identify the accessibility needs of people with disabilities and health impairments.
Thank you for that suggestion. We really appreciate it. And we are looking at adding and more resources for neurodiversity in our curriculum and in our office and in the agency as well. We have quite a few people who identify as neurodiverse.
I'm curious, what overall topics, marginalized groups do you educate about? As well, do you use general DEI content, nationally available content, or do you incorporate local relevance as well? If so, has that been helpful?
Oh, that was a loaded question. Okay, so yes, we use a sampling of both kind of nationally recognized DEI principles, as well as things that are happening locally and within our own DESC community for our clients and our staff, the demographic makeup of our clients and staff. We take all those things into consideration. What was the first part of the question?
Yes. So I'm curious, what overall topics / marginalized groups do you educate about as well? Did you want me to keep going or?
No, yeah.
Okay.
So, I think, our agency, obviously deals with people who are unhoused, who have mental health, behavioral health, and substance use challenges. And so, we cover those topics quite a bit. We really value people with lived experience and employ, and have a pretty robust program around our peer employees. And so our topics really range from kind of all of those things: mental health, behavioral health, being unhoused, substance use. And then, on the other side of that, for, most of our employees, not most, but our employees who identify, how they're coming out of those challenges in terms of recovery, and then how to loop that back around to help our clients.
Is the reporting form also available to the clients if they experience a microaggression from a staff member?
The reporting form is not available to the clients, but there is a client reporting mechanism where clients can report grievances with staff, and they do use that.
I feel one of the best ways to recruit and retain BIPOC staff is for agencies to pay livable wages, adequate sick and vacation time, healthcare benefits, etc., especially to the frontline staff. Our agency struggles with this. What are your thoughts?
Yeah, it's something that DESC really has committed to since COVID, and with union participation, to pay a livable wage for our frontline staff, folks that are in our facilities or janitorial services, and that's something that we've been really committed to, and we've we've put on hold some growth opportunities with the agency from an administrative standpoint to improve and raise frontline and direct service staff wages. So we definitely are committed to it. Obviously, we could do better. I think that it really is going to be, lie with your leadership to be committed to providing a livable wage and the value of that in terms of what you stated in terms of retention.
If we don't have a union available for employees, what would you recommend as an alternative?
I would say groups. If you can get a group, maybe not the equity and social justice, if that's not what it's going to be called, but a group where you have leadership, mid-level, and direct service staff, where they can really come together and kind of talk about the issues. And then, someone or a few people from that group being the ambassador and the advocate for leadership or the board or, whoever is making those decisions.
This is marked as unanswered, but I feel like I asked it already, but if so, just let me know. What types of training programs or educational initiatives have you found most effective in promoting DEI within behavioral health settings?
Yeah. Okay. So we have a robust learning and development team. And so we have a ton of training programs within the agency. There are a lot of different training programs around DEI. We have created our own and pulled from some resources outside the agency. And so I would tell you Google, because I think it will really depend on the needs of your agency and what it is you're trying to address within your DEI initiatives.
Okay, this one is for Chelsea. You mentioned taking time to decide how/if an agency collects patient demographic data. Can you say more about how DESC came to that decision and how you've implemented that data collection?
Yes. So one thing that DESC does as a behavioral health agency, during our intake with clients, that kind of demographic information is collected then. Obviously, it's done by whether or not the client wants to. Clients can refuse to, identify with any demographic areas if they want to. But because we collect that demographic information upon intake, we are able to then use that information to see what else is going on. So that is how we collect our demographic information. And over the time that I've been with DESC and even prior to my role, the conversations around how we can use our data to speak to what's going on. So how do we know we're being equitable? How do we know who we're actually serving? So looking at the statistics of the people we serve, so the Seattle area, looking at who are the most vulnerable and who are the most susceptible to falling into these situations, such as being unhoused. And so being able to do that and looking at the data and those demographics that are taken on intake, the directors and other leadership have looked at how we can utilize that information. And so I would say that leadership has made that a priority to make sure that we have the data that we need to speak to whether or not we are actually being equitable and what our efforts are actually looking like.
Okay, I think we have time for one, maybe two more questions. It seems to me that behavioral health challenges may play a bigger role in state of living conditions than the demographic categories mentioned. Is this tracked? Also, if this isn't tracked, it could paint a skewed, biased picture.
Yes, thank you for that. Yes, that's another aspect of an analysis that we hope to get into. We stuck with just the demographic information. This is a race, equity, and social justice conference, and so being able to speak to those areas that are specific to those demographic categories, but also because we are a behavioral health agency, we do acknowledge that there are other things that can impact someone's living conditions. And we are not looking at this as a causation, right? It's not because this person is a female, their unit is better. It's why maybe is this particular group of people experiencing something different, and that may come from either their mental health status, their substance use. That could also come from the amount of service provision that we're providing. And so being able to identify not just the demographic information, but also looking at those areas where you're looking at the health challenges can help us to have a more robust analysis. And that is something that we are looking to include in kind of those next stages of getting, of using the data to look at how it's impacting our clients.
All right, and I'll just share this last request. Someone asked, can we get a copy of the form for microaggression reporting? It looks really good. I believe, yes, if you all can share that, I believe that would be sent out after the conference when all of the videos of the presentations are available. So yes, we can get that to you. But thank you so much. It's time to wrap up for the day. But yeah, we have a lot of questions that we didn't get to. So thank you so much for this presentation. Obviously, everyone was very engaged and very thankful. So again.
Well, thank you. We feel lucky, and thank you for inviting us, and we'd be happy to come back.
All right, amazing.